Also on yesterday's show, we talked about President Trump's post about the COVID vaccine. This is a 180 for President Trump. In the past, he's been very loyal to the COVID vaccine, but now he is asking for more details. He says many people think that the COVID vaccines, are a miracle that saved millions of lives. Others disagree, with CDC being ripped apart over this question. I want the answer, and I want it now. I've been shown information from Pfizer and others that's extraordinary, but they never seem to show those results to the public. Why not? They go off to the next hunt and let everyone rip themselves apart, including Bobby Kennedy Jr. and CDC, trying to figure out the success or failure of the drug company's COVID work. They show me great numbers and results, but they don't seem to be showing them to many others. I want them to show now to CDC and the public and clear up this mess one way or the other. I hope Operation Warp Speed was as brilliant as many say it was. If not, we all want to know about it and why. Thank you for your attention to this very important matter. As I said yesterday on the show, this takes tremendous humility. And it's one of the qualities that I admire the most about President Trump is his intellectual curiosity. He wants to know the truth, even if the truth isn't necessarily the position that he prefers. I admire and respect this so much about President Trump. But here's the thing. This information about the COVID vaccine has been widely available for a long time. The information, the questions about the efficacy and the safety have been out there for the public consumption for years now, since the inception of the COVID-19 vaccine. Now, what's happened, if you are the president of the United States, you have a staff around you. You're in the Oval Office. You can't hear everything. You can't read everything. You can't talk to everyone. So you have a staff around you that serves as a gatekeeper. And a good gatekeeper in that role gives you the information that you need and makes you appointments with the people that you need to speak to and protects you from being overwhelmed by an inundation of information and people. Now, where gatekeeping can go wrong is if people with an agenda prevent you as the CEO of a company or the president of the United States from hearing, reading, seeing data or talking to people that they don't want you to talk to because of their own political agenda. If that is the case, if President Trump has been subject to politically driven gatekeeping, then there's one course of action that needs to be taken. You need to raise your voice because you know these statistics about the COVID vaccine as well as I do. And you know as well as I do that when President Trump is subject to gatekeeping, the only thing that can overcome that is you. The only thing that can get President Trump the information that he needs is when you raise your voice. So raise it now. You and I know the statistics that the COVID vaccine, people who got the COVID vaccine were 23% more likely to die from COVID, according to some studies. You and I know that the development of the mRNA technology itself was shady. This was a post by Hans Monkey, a guest who you guys loved. We had him on to talk about Russiagate a couple weeks ago. He posted this on X. He said the key to understanding the mRNA deception lies in the history of the technology itself. mRNA was first developed in the 1960s, but it couldn't be delivered into the human body because RNA, unlike DNA with its double helix, is highly unstable and would fall apart before ever reaching cells. The obstacle was only overcome in 2018 when a new delivery system was created using little fat bubbles that protected the mRNA long enough to enter cells. At that point, Fauci and the pharma crowd were itching to push the technology into humans. All they needed was an excuse. And conveniently, that excuse arrived in the form of COVID. Remarkably, Fauci signed an agreement with Moderna to mobilize mRNA vaccines for COVID on January 13th, 2020, at a time when the public was being told the virus was not a problem and couldn't even spread between people. Hans Monkey said, it's encouraging that Trump has made a U-turn on this, but the story isn't just about drug companies. It's about Fauci, who is the glue holding it all together. It's almost beyond belief and perhaps unique in history that one man could stand at the center of it all, helping to foster the creation of the virus in a hostile lab, covering up that fact, promoting the supposed miracle cure, seizing control of the response, embedding himself in the White House, and manipulating every lever of power. And yet, half the country still treats him as a hero. This is what truly needs to be exposed. You know this, and I know this, but does the president know this? In India, you want to talk about transparency of data, which is what President Trump's calling for? In India, The Indian authorities told Pfizer that they needed to provide more data about the vaccine. Otherwise, the Indian authorities were not going to give Pfizer the go-ahead to unleash the Pfizer COVID vaccine on the Indian people. Now, understand that India would be a potential 1.3 billion customers. That's the market in India. And so when Pfizer was faced with the choice of providing regulators evidence, proof in the form of data that the vaccine was safe and effective, Pfizer refused to do it. They literally said we'd rather give up over 1 billion customers than provide that data to you. You and I know this, but does President Trump know this? Now, President Trump, we know, was lied to by industry, by Pfizer, by Big Pharma, by public health authorities like Dr. Fauci, like Dr. Deborah Birx. He was lied to early on in the COVID pandemic about the number of people who were dying from COVID versus the people who were dying with COVID. He was lied to about the people who died from COVID, whether they were vaccinated or unvaccinated, because of one very shady statistical trick that, perhaps unironically, Bobby Kennedy exposed very early on. Take a look.
The vaccine is ineffective for the first 6 weeks after the first shot. I'm assuming a two-shot, a two-dose vaccine like Pfizer or Moderna. And that during that period, the COVID infection rate goes up and the death rate goes up. And the data, the official data, do not count you as vaccinated until 2 weeks after the second shot. So the deaths that happen during that first 6 weeks are attributed to unvaccinated people, to the unvaccinated group, which is not, it's a trick. It's a statistical trick. Then the vaccine appears to provide immunity, and good immunity during the first month or 2 months, and then a precipitous decline, a waning that happens very, very quickly and very precipitously, so that by the 7th month, it has lapsed into negative efficacy. And what that means is that after 7 months, if you had that vaccine, you are more likely to get COVID than somebody who has never been vaccinated. And this data is holding up across every country in the world.
Okay, that phrase, negative efficacy for the vaccine. The fact that if you take the COVID vaccine, you're ultimately more likely to get COVID, to contract COVID, than if you are unvaccinated. There was evidence, there were studies that showed the vaccine, the COVID vaccine, the COVID mRNA vaccine, resulted eventually in negative efficacy. These studies were available publicly as early as 2021. We knew about this. If President Trump did not, we should ask who hid this information for him and why wasn't he told? If Pfizer was telling President Trump a different story, then the president should hold them accountable, because Pfizer knew about the increased risk of myocarditis, inflammation of the heart that can lead to sudden death. We don't even know what the long-term implications of those who recover from myocarditis is. We don't know if they're going to die young. We don't know if it's taken years, maybe decades off their life. We don't know. But Pfizer knew about the increased risk of myocarditis among young men who took their vaccine, and they hid that information. They were not upfront about the fact that blood clots were more likely if you took the vaccine. That Guillain-Barré syndrome was more likely if you took the vaccine. That pericarditis, another heart inflammation, was more likely if you took the COVID-19 vaccine. We knew all of this information, but did President Trump? And so the challenge that I pose to you today, before we move on to the Maha infiltrator who is trying to take Bobby Kennedy out, the challenge I pose to you today is, if you had 5 minutes with President Trump to answer his question about the safety and efficacy of the COVID-19 vaccine, what would you say to President Trump? Post it on X. Record a video and put it on Facebook and Instagram. Raise your voice, because you know that the way to overcome gatekeeping with President Trump is you. You are the way to overcome gatekeeping. So raise your voice like never before. And remember, we're never going to convince a certain segment of people to believe the truth. 3 years ago, 50% of Democrats thought that unvaccinated people like me should be sent to camps. 30% of Democrats thought that the government should take your kids if you are unvaccinated and you don't vaccinate your children. This is who we're up against. 3 years ago, do not let them memory hold us. Listen, I've been a part of the MAHA movement for a long time. And as I said on the show yesterday, this has translated now into the reality that I'm fortunate enough to have a lot of contacts at HHS. Let me tell you, I was on the phone a lot this weekend. There is a belief among some who are highly connected that they need to convince the American people before they make any of these paradigm shifting changes that you and I are demanding. They want to be incremental. They want to wait until there's an overwhelming demand for it. Which means it's incumbent on you, demand it. Show them that you're convinced. This is what I told some of my sources. I told one of my sources that MAHA moms like me are so frustrated with the incrementalism at HHS, even though we think that everything that Bobby Kennedy has done is awesome. We feel this tremendous urgency because President Trump's going to be president for 3 more years. We have a very limited window to get really serious things done. And we are so afraid that we don't have enough time that's the risk. That's where HHS risks losing our enthusiasm. Listen, we are here to fight. Just like we did before President Trump shook hands in that iconic photograph with Bobby Kennedy on stage during the campaign, we are here to fight. We are here ready to defend Kennedy against industry attacks and mainstream media smears. We are here to trounce Big Pharma and fake news, to make America healthy again, to protect our children. You can think of us like war fighters who have trained all of our lives to be dropped behind enemy lines, to take out the bad guys. And yet we never get to do anything but run drills and practice? Put us in, coach. Get to the paradigm shifting changes. Raise your voice. This is your moment. This is your moment.